According to CDC.gov, about 1 in 4 girls and 1 in 13 boys experience child sexual abuse at some point in their childhood. The Adverse Childhood Experience Study found slightly over 20% of adults who were born in the 1930s, the 1940s, and the 1950s has experienced it. The study has been replicated many times over the last 20 years in younger demographics, and that same percentage is found. We also know that it takes survivors of sexual abuse on average about 21 years to disclose abuse, and about 80% of the people who sexually abuse them will never see a day behind bars. Childhood sexual abuse has been correlated with higher levels of depression, guilt, shame, self-blame, eating disorders, anxiety, repression, denial, sexual problems, and relationship problems. Pedophilia is the sexual preference for or a strong sexual interest in children. Pedophiles are sexually fixed on underage individuals, and the term pedophile refers to a sexual orientation towards children prepubescent. Only 3 to 5% of all sex offenders can be classified as pedophiles. Child molestation is defined as sexual contact between an adult and a child victim. Most child molesters are not committed by pedophiles, and not all pedophiles are child molesters. Child molesters are defined by their acts. Pedophiles are defined by their desire. Some pedophiles refrain from sexually approaching any child for their entire lives. Although most experts do think a person's feelings of pedophile are curable, therapy may help them manage those feelings and not act on them. For the next 17 to 19 minutes, we will be investigating the answers to 4 questions. It's the solution to these questions that will lead you and I to the best possible result in regard to treatment options for non-offending pedophiles. Question number 1, is pedophilia a sexual orientation? Question number 2, what current treatment options are available for pedophiles who have not offended? Question number 3, what is the recidivism rate currently using traditional punishments? Question number 4, what is the significance of the crime? After close consideration of these questions, we will be able to come to a logical conclusion to these answers. Let's examine our first question. Is pedophilia a sexually orientation? First, it's important to understand that pedophilia and child sexual abuse are not the same thing. Pedophilia refers to an enduring sexual interest in prepubescent children, which may or may not be acted on. Pedophilia is defined in the Diagnostic and Statistic Manual of Mental Disorders, 5th edition of the American Psychiatric Association, as a sexual attraction to prepubescent children. This sexual interest is indicated by recurrent, intense, sexual arousing fantasies or sexual urges or behaviors involving sexual activity with children generally around the age of 13 or younger, and must be present for at least 6 months. A study in 2014 by Wardle, S. K. Simmons, D. and Marino, titled Sexual Interest in Children Among Online Sampling of Men and Women, found that it is estimated that 3 to 9% of males in community samples are in some way sexually attracted to children. In reality, the causes of pedophilia and child sexual abuse are multiple and complex. Given the public opinion influences law and policy, it is critical that the public is better informed about this important issue. The last few decades had seen increasing evidence that pedophilia is biological, and more specifically, that it might be neurological in origin. A study conducted by James Cantor in 2005 called Quantitative Reanalysis of Aggravated Data on IQ in Sexual Offenders found that 2% of sexual offenders with pedophilia are also more likely to report experiencing head injuries, a possible source of brain damage, before the age of 13. The law takes an awkward and incoherent approach because it confronts the issue pedophilia raises only after it manifests itself in criminal behavior. This squanders opportunities to treat pedophilia early, which experts argue would improve treatment outcomes and prevent child sexual abuse. This leads us straight into our second question. What are the current treatment options available for pedophiles who have not committed an offense? Treatment is effective only if a patient with pedophilia is motivated and committed to controlling their behavior. Outcomes are better when treatment combines psychotherapy and medication. On this next slide, we're going to go over what those two different treatments look like. So we have a few different treatment options they have. They can do psychotherapy. Most psychotherapies used to treat pedophilia incorporate the principles and techniques of cognitive behavioral therapy. The focus of therapy is to enable the patient to recognize and overcome rationalizations about his behavior. The drug treatments that are used primarily are drugs that suppress production of the male hormone testosterone and are used to reduce the frequency or intensity of sexual desire. Although physical castration is another option, testosterone suppression offers advantages such as the need for follow-up visits. This can help aid in monitoring their behavior. It may take 3 to 10 months for testosterone suppression to reduce sexual desire. One shortcoming in the research on treatment is that it usually focuses on individuals who have committed sexual offenses, with little attention given to the treatment of non-offending individuals living with pedophilic disorder. Fred S. Berlin, a pedophilia expert from Johns Hopkins, published an article in 2003 titled Sex Hormones, Neurotransmitters, and Psychopharmacological Treatments in Men with Paraphilic Disorder. He stated that the principal goal of therapy is to help patients learn to control inappropriate sexual thoughts and behaviors, to gain empathy for victims, and to develop effective relapse prevention strategies. The lack of research and large-scale treatment programs for those outside the criminal justice system is a source of frustration among non-offenders, with some forming their own support groups to fill the gap. A relatively new German project seeks to address these problems by providing confidential and free treatment for both offending and non-offending individuals. Prevention Project Dunkerfield, or known as PPD, offers treatment and support to individuals sexually attracted to children to prevent sexual offenses. The therapy focuses on helping patients learn an appropriate perception and appraisal of their sexual wishes and needs, the identification and coping with dangerous developments, and strategies for the prevention of sexual assault. Luteinizing hormone-releasing hormone, also known as LHRH agonist, are drugs that lower the amount of testosterone made by the testes. Treatment with these drugs is sometimes called medical castration because they lower androgen levels. A study published by the Scientific Journal of Medicine called Treatment of Pedophilic Disorder in 2017, titled Sexual Offenders or Men with a Risk of Sexually Offending with Luteinizing Hormone Releasing Agonist, LHRH agents are a useful treatment when combined with psychotherapy in patients with paraphilic disorder and the highest risk of sexual offending. However, throughout the treatment, close monitoring of side effects is needed, and ethical concerns must always be kept in mind when trying to prevent sexual assault. This brings us to our third question. What is the recidivism rate currently using traditional punishments? Recidivism is one of the most fundamental concepts in criminal justice. It refers to a person's relapse into criminal behavior, often after the person receives sanctions or undergoes intervention for a previous crime. The recidivism rate of sexual offenders is very difficult to measure just due to the fact that few sexual offenses are reported to authorities. The punishment of an offending pedophile can have in the United States can vary from state to state. This is true as well for treatment options for a convicted individual. One of the largest meta-analysis of studies of the effectiveness of sexual offender treatment was conducted by Lossell and Shoemaker in 2005. The analysis included 69 independent studies and a combined total of 22,181 subjects. The researchers found an average sexual recidivism rate of 11.1% for treated sexual offenders and 17.5% for untreated sexual offenders based on an average follow-up period of slightly more than 5 years. In the same way that we look at recidivism rates using traditional punishments, we will now look at the recidivism rates associated with chemical castration. Not to get confused with sterilization, chemical castration does not remove any organ from the body. Unlike surgical castration, chemical castration is completely reversible by discontinuing the treatment because no permanent physical change is made in the body. The procedure of chemical castration involves administering medications via injection or tablets. This suppresses the sex drive of offenders by decreasing androgen levels and thus lowering testosterone levels. An article published by Thomas Jefferson Law Review on April 1st, 2005, titled Punishing Thoughts Too Close to Reality, a New Solution to Protect Children from Pedophiles. Dr. Fred S. Berlin of Johns Hopkins stated, when a sexual offender's acts are fueled by chemical, hormonal, or genetic imbalances, a combination of medication and therapy can successfully extinguish the offender's inclinations. Berlin found injections of the female hormone, Depo-Provera, drastically reduced male hormone levels, thereby eliminating sexual urges. Even though chemical castration is not as invasive as the permanent surgical alternative, the number of possible associated side effects may pose a serious burden to the sex offender who undergoes treatment. An article published by Journal of Bioethical Inquiry in 2013 titled Coercion, Incarceration, and Chemical Castration stated an argument from autonomy states a range of negative adverse effects have been associated with chemical castration, such as It initiates andropause, which is the male equivalent to female's menopause, and may result in severe mood instability and, in some cases, clinical depression. It may also cause weight gain, insomnia, hot flashes, diabetes, migraine headaches, and especially in cases of long-term use, bone deterioration. However, the proven effectiveness of chemical castration as a treatment regimen for sexual offenders seems to outweigh the drawbacks. This leads us into our fourth question. What is the significance of the crime of pedophilia? The lasting effects of childhood sexual victimization may vary with the individual. An academic article written by Kay Brakwani and Sibeth Deb of Applied Psychology in 2013 called Child Sexual Abuse a progressive social disorder. They state their physical health also becomes at risk for obesity, high blood pressure, and heart problems. Research suggests, though, that sexually abused children begin exhibiting negative emotions effects soon after the abuse begins. They can start having symptoms of depression, anxiety, fear, guilt, shame, the withdrawal. They suffer from low self-esteem, acting out in school or social situations, sleep disorders, and eating disorders. Further, sexually abused children display recurring emotional and psychological impairments later on in their adult lives, many times with more severe consequences. According to the child, substance and alcohol abuse and suicidal behavior are more prevalent in adults who were victimized sexually as children. Often, childhood victims continue the sexual abuse cycle as adults by marrying abusive partners or even by abusing their own children. Not surprisingly, some of the most common injuries in adults who were sexually victimized as children are sexually related. Some studies indicate that sexually abused children may struggle with sexual dysfunction in their adult lives, indicating this includes promiscuity or difficulty maintaining healthy sexual relationships. It is important to note that a large number of victims of child sexual abuse goes unreported. A study published in 2017 called "In the Aftermath of Disclosing Child Sexual Abuse: Consequences, Needs, and Wishes" found that overall 86% of the victims did not report the abuse to legal authorities. Such a tragic and emotional psychological legacy of childhood sexual victimization demands an effective and lasting treatment plan for the perpetrators of these crimes. This brings us to our final thought. While researchers' knowledge has been evolving, access to widespread, up-to-date healthcare has not kept pace. Outside of the handful of researchers who provide therapy and medication to pedophiles, the barriers to finding an informed therapist or psychiatrist remains high. James Cantor, a clinical psychologist and sexologist specializing in hypersexuality and atypical sexual interests, said, "The goal of any modern preventative treatment for pedophilia should be to help people manage their sexual interest rather than try to change them. This can involve the voluntary use of hormone-reducing medication to control urges or therapy. Since pedophilia and sexual abuse are not synonymous, treatment for pedophilia is also not solely about preventing child sexual abuse. It's a it's about helping people with their overall mental health and well-being too. That's a concept that may be hard to accept. It involves recognizing that people who were sexually attracted to children deserve to live healthy and meaningful lives.